Dear friends, welcome back to Vicenza. I think it's with great emotion that I welcome you to this 35th anniversary. We used to open our courses saying the family is back. Actually, we started many years ago in 1982 with the first course on peritoneal dialysis. It was a very interesting group, the Vicenza, with Professor La Greca, our boss, and all our colleagues at that time. You see a young Claudio Ronco with less kilos and more airs. And in 35 years, we had support for science and education from the major institutions. And I want to thank really the Regione Veneto, our hospital. Today is called ULS Otto Berica, the institution where I'm working. As you can see here, the first group of teachers was including the fathers, the pioneers of peritoneal dialysis, Fred Bone, Karl North, Popovich, Moncrief. Historical landmarks were discussed at that time. But over the years, the most important achievement has been to put together the world of ICU with the world of renal disease, creating a new discipline called critical care nephrology. Today, in several hospitals around the globe, when they create a critical care nephrology center, they define this according to the so-called Vicenza model. Again, this was the first symposium on CRRT in 1986, and these people met a few years later in a special celebration for Lee Henderson. In 1990, Rinaldo Bellomo and myself wrote this editorial saying critical care nephrology, the time has come, where we advocated the concept of working together. Critical ill patient is a puzzle. Combined nephrology and critical care diagnostic measure and therapeutic strategies are required to achieve clinical results. No one can whistle the symphony. It takes an orchestra to play it. And we cannot play the same instrument, but we have to be on the same key. That was the first treatment ever done in Vicenza in 1977, just after Peter Kramer started the treatment in Göttingen. And here is the evolution of history from the first treatment into specific devices generated in Vicenza, some adaptation of special machines. This was a machine created here in Vicenza again. This was the first machine, the Prisma, designed specifically for a critically ill patient. The other generation of this machine, and subsequently the use for liver disease, the treatment of sepsis, the new respiratory dialysis and removal of CO2, and finally, most recently, the last generation of machines for CRRT. I think that we have to say that the first treatment in a neonate in Italy and in the world was performed in Vicenza in 1982. And again, we were so happy to be able to develop new technology with the search of mini filters, with the search of a new membrane, creating new devices, and finally treating the first baby in '82. After that, this treatment evolved into CRRT in neonates all over the world. We then developed a fluid balance system, CVVHD with mini filters. We applied the pediatric sets to adult machines. And finally, we started our major project with the design and development of prototypes that led to the final first machine called Carpe Diem, that stays for cardiorenal pediatric dialysis emergency machine. And finally, we treated the first baby in 2013, while today this machine is used all over the world. Techniques have been developed in conjunction with different industries and are now used all over the world, including high volume and pulse high volume hemofiltration and other types of treatment. This was the really first drawing of the Carpe Diem machine. This is to show that our International Renal Research Institute often starts a project from scratch, from the white page. And I think this is very important to see how much this has led to the development of the first baby treated in the world with this miniaturized machine. Another example is the first echo machine evolving into more sophisticated machine. And here you see, for example, in other museum, our museum contains the very, very first prototypes that finally led to important development. This is one of the most recent machines developed by the industry. So beginning, evolving, and leading to the final technology. That's why most of these machines contain small pieces or entirely pieces of Vicenza in their heart. And this is because every technology practically is somehow coming to Vicenza to get the final testing or even the initial development. Because we know that in critical care nephrology, every moment counts, we are particularly careful on biomarkers, and we have developed an app to alert the nephrologist so that we can actually have real-time intervention. And by doing this, we were able to reduce the number of patients requiring renal replacement therapy over the years. A few publications. I think that these books have now crossed all the continents, and I'm particularly happy to announce that we are going to have a new book very soon, Critical Care Nephrology, with Rinaldo Bellomo, John Kellum, and Zaccaria Ricci. This will be the latest of the publication, and will come out probably in September, October. The number of publications and citations from our institutes are ever increasing, showing that this is an important institute for research. I think that the Johns Hopkins University for 2 consecutive years have somehow classified our research point as #1 in the field of renal disease. In the year 2000, together with a few friends, we developed the consensus group called ADKI, and here is the first picture. You see the kind of, let's say, tie I had at that time. And Nathan Levine and I developed this congress in Flash Meadows while the American Open for tennis were playing, but we were forced in this hotel, creating, however, the very first international consensus paper on continuous renal replacement therapy. A few years later, we met in my country house. This is my, not really, but it's a very nice Palladian villa, of course, and we met to develop an important strategy, which is the new classification of acute kidney injury, which now has been quoted all over the world, and it is #1 paper in critical care. Last year in Asiago, we developed the consensus guidelines for the application of technology in renal replacement therapy. Here we are taking the cappuccino. I will explain later what is the meaning of this, but the important thing was that we also asked the companies to develop a common language that should be utilized in machines and devices so that large, big data can be collected for programmatic trials. So this nomenclature standardization initiative alliance included many companies that accepted the idea to try to homogenize the definitions. Nothing could be done if we didn't found 5 years ago the International Renal Research Institute of Vicenza, idea that came from the fact that I spent 2 years in New York with Nathan at the RRI, and the idea was to gather experts from all over the world, from different disciplines, including medicine, engineering, pharmacology, biology, economics, and these are our laboratories that are very active, together with our fellows coming from different parts of the world. In 2012, they came to Vicenza for the fellow reunion, and we have now trained more than 120 fellows from all over the world. We have initiatives for educational plans with the International Society of Nephrology, and even this course will be fully recorded, and you will find it in our website and the International Society of Nephrology website. We have to acknowledge the endorsement of the major scientific societies, and also we have to thank our sponsors that make possible, especially the fact that we have approximately 70 young nephrologists and intensivists that came here completely supported financially without spending a penny. And I think this is important because we are investing in our future. The interaction with companies goes from all over the world. This was done in America or China or Japan or Singapore. I don't remember, but the important thing is that we have fantastic collaboration with the world, and we feel to be citizens of the world. This is a meeting that we organized together with Fudan University in Shanghai. You see here the Shanghai Tower and the Rotunda together in this book. This is when I became visiting professor at the Fudan, and this at the Jiao Tong University with Professor Ni. And an important sistership, of course, we have it with the University of Virginia, where next year will be celebrated the 200 years of Thomas Jefferson and the University of Virginia. So Palladio cannot be absent, and that's why with Mitch Rosner we have a fantastic collaboration. The main building of the University of Virginia is called La Rotunda, so practically we feel very much at home. How many registrants this year? 462. In general, we have this split from different countries. We have approximately more than 50 countries coming to this meeting. This is a tradition of a melting pot. The people who will follow the ultrasound and imaging technique will receive the book that we generated last year as a textbook for practicing this type of diagnostic procedure. And we also deliver this book to people that will fill the questionnaire. This new book, Perspective in Kidney Disease, will be delivered as a token of appreciation. Now, importantly, in this meeting, the results of the Euphrates trial, which is a trial done in Canada and United States, will be presented tomorrow night at 5:30 p.m., and it will be webcasted in all over the world. We are very anxious to receive information about the results of this international trial. We have to be grateful to our secretariat and to our team, because without them, especially Anna and Gioia, we could not really make what we have done so far, and especially to our team in San Bortolo, a group of fantastic physicians that are actually taking care, first of all, of the patient, which is our main mission.